Working is presented by Maya Strategy Group, a leading market research and strategy consulting firm, helping clients in the pet care and animal health industries navigate strategic challenges for almost 2 decades. Hello, everyone, and welcome to Pet Working. I'm Peter Kenseth, and today I'm very excited to bring to you the first in what we hope will be a many-part series with Heska. From a consumer perspective, you may not be intimately familiar with Heska, but they're one of the largest providers of veterinary diagnostics in the United States. Earlier this year, they were acquired by Mars for, I believe, a purchase price of $1 billion. And we're fortunate enough to have Dr. Ben Hantler, who is a product manager at Heska. Also, Ben is a former practicing veterinarian. He got his veterinary degree from Tufts, graduated in 2014, went into practice, was an associate veterinarian at Banfield for several years, got his MBA while he was at Banfield, and came on board with Heska as a product manager in 2020 and has been there since. I also have with me today my colleague, Jessica Stewart, who assists me with the animal health practice here at my strategy group. Jess has a great background for this topic. She is a former diagnostic support consultant at IDEXX, where we plucked her from about 5 years ago and brought her over to Maya. And it's been a pleasure working with Jess for over a half decade, and really excited to have her perspective here. Being able to bring not only a consulting perspective in the role that she's operated in the last 5 years, but also the the in-practice perspective, working as a diagnostic support consultant at IDEXX. So really excited to discuss preventative diagnostics with Ben and Jess today. And I think, what we see so often and the importance of preventative diagnostics is that one of the biggest issues, and Ben, feel free to chime in here, is the number of pets that do not get to a veterinarian regularly. And so often I think veterinarians are presented with cases where animals are in a really bad state, but a very preventable bad state that could have been circumvented had they seen the vet more often and had they had the chance to have preventative diagnostics administered to them. So Ben, maybe that's a great place to start.
Absolutely. And thanks, Peter. Thanks, Jess, for having me. Nice to see everybody. And you're right on. When I was doing a little bit of background on this talk or our chat here, I looked into, about approximately what is the industry standard for how often or how many people are bringing their pets in once a year. As a clinician, I could give you an estimate of my clientele, but what does it look like? And it looks like it's only around 40 to 50% of pet owners are bringing their pets in once a year. And if you compare that to people, right, if we're talking about you and me, how often we see a physician once a year, if you look at that study or those studies in the US, it's closer to like 80 to 90% of people are seeing our physicians once a year. And so our goal as veterinary professionals, and whether you're a clinician or in the product management space, is to bump that number up so pet owners are also coming in once a year, because our animal friends need that preventative care and diagnostics almost as much or as much as we do. So it's a great topic and good thing that we're talking about it.
Yeah, absolutely. I mean, I think when you look at the barriers to people bringing their pet into the vet more regularly, there's obviously the financial component of it, right? The cost of veterinary care continues to escalate. Thinking back to when we got our dog 6.5 years ago, I think it was $65 for a vet visit back then. It is now well over $90, possibly even approaching $100 just for the visit. And then when you factor in on top of that, the costs of any tests that are administered while your pet is at the vet, a lot of people look at it that, if I'm not seeing overt signs that my pet is struggling, I probably don't need to bring them. But I think, it's one of those things that dogs and cats are very good at masking issues that they might be having and not outwardly showing any signs of pain. And so getting pets to the vet at least on an annual basis is really critical to maintaining their health and longevity. And maybe we'll go down this route. I know we could probably spend a whole episode talking about pet insurance, but I think pet insurance is certainly a huge antidote to this problem. But keeping the focus on preventative diagnostics and maybe getting Jess's perspective here. Jess, back when you were a diagnostic support consultant, what percentage of the tests that you were assisting with were of the preventative variety? And maybe we can look at that as, a proxy for how things have changed over the course of the past several years.
Yeah, so things have definitely changed. Back when I was at IDEXX, it's hard to maybe put a figure to it, but I mean, there were, even back then for IDEXX, there were a ton of like wellness profiles. They included, maybe like a chemistry, a CBC, maybe a UA, a urinalysis, maybe some thyroid, and two, they were divided out, by, the age of the patient, right? So there were like young wellness profiles, and then some that were geared towards like more senior pets or adult pets, both for the canine and feline species. But I would say a lot of the profiles that came through, or the tests rather, that came through, were preventative in nature. And those were often fielded, pretty easily by the customer support teams. A lot of the tests that we saw getting elevated to us were case management related. So certain presentation of the patient, but sometimes those patients just needed a wellness profile to see where they were, because it's important to trend that year over year, right? Just like for us, humans. So I think the importance of preventative care has really come through in the past, however many years we're at now, 8 years, 7 years since I was at IDEXX initially. And I think that preventative care then too, a lot of the veterinarians may have been thinking that was kind of parasite monitoring, neutering or spaying, vaccines, right? It didn't really include diet or nutrition or exercise, those kinds of things. And the evolution since then is just really awesome to look at. But I still, based on Ben's number, only 40%, I think there's, really a long way to go to drive up, the numbers in terms of those that are actually seeing a veterinarian, annually.
Ben, I guess from your perspective, how many cases when you were practicing did you see where you could easily determine that if this pet had been brought in more regularly, if this was the first, if this pet had, wasn't their first time coming to the vet in 4 or 5, 8 years, I'd be able to correct this. How many of those cases did you see? And what are the most common illnesses that you see arising from a lack of regular visits to the vet?
Yeah, it's a great question. And you see more than you'd like. And it's hard to peg a number, whether it's a number or percentage, but it was probably, if I was guessing on a percentage, 20 to 30% of the ill cases that you would see, you'd think to yourself, oh, if they had just come in every year, we probably would have caught this. And the second question there, what are the most common things? Dental issues are number one by far. When the pet hasn't been in, I guess we're talking about dogs, cats, maybe some horses and rabbits mixed in there where we're talking about dental disease. But with dogs and cats, if they haven't been to the vet in a very long time, dental disease is probably the first thing that I'm going to do an oral exam. I'm going to do a full physical, but dental disease, skin disease, and then you were talking about nutrition, right? Those are the 3 big things that I would think of when that pet hasn't been in a long time that are going to be probably abnormal and really easy things to prevent going bad, right? If you brush your pet's teeth at home, or if you bring them in semi-frequently to get dental cleanings, you're not going to have to worry about partial full mouth extraction. And what that means is sometimes we have to take every tooth out. I've seen that, unfortunately. And those are the cases, right? That the pet comes in and they haven't been to the vet in a long time. And I say, well, all the teeth are bad. We got to take them all out or you risk infection. So it's a great question. And unfortunately, we see it a little bit too much. But that's the goal, is to get people awareness.
Yeah, no, and that's not even touching on diagnostic. That's purely from a dental perspective. That's looking and seeing, what level of plaque and tartar buildup. We did an episode a few months back with Dr. Heidi Lopres, who's a certified veterinary dental specialist. And, you're absolutely right. So many people, A, don't brush their dog's teeth every day, and B, don't get them into the vet regularly, so they don't get their, annual dental cleaning, or even, every even 2 to 3 years would be preferable to not having it done at all.
Mm-hmm.
And when we look at this, are there, obviously there's a financial concern to it, Ben, and I think, for a lot of vets, one of the challenges is that they don't want to be seen as pushing services on their patients. It's, as we talked about, the cost of a visit is expensive, and every test that you run therein after only serves to escalate the total bill.
Mm-hmm.
In your experience, either, from your personal experience in practice or in the, talking with your veterinary community, your colleagues at Heska, the vets that Heska sells products to, what kind of, what is the level of concern, and is this something where we almost need to educate the vets to, make this more of a necessity rather than feeling, like I'm pushing a product on somebody?
Yeah, no, it is a concern. Yes, another great question. A lot of these topics kind of go hand in hand, and there's a little bit of both. I think one thing I would say to pet owners is don't be afraid to ask questions. You might be afraid that, well, if I look on Dr. Google, if I go on the internet, that some of that stuff might not be accurate, and I'm not going to go to the professional with that information. It's okay, really. I was fine with it. Like, if you ask me a question, I'm going to give you my professional opinion. And I think that's sometimes vets won't do that because they're afraid of, oh, I'm going to be looked at pushing this product, or it's so expensive and they're going to look at me different because I'm recommending this diagnostic. And like you talked about earlier, pet insurance is hopefully a good kind of remedy for some of this. But if you don't have pet insurance, or even if you have insurance and there's still high costs, there's a fine line. And some of that is also on, us in our diagnostic supplies to inform vets, look around you too, because a lot of veterinary practices are incorporating this as part of their standard protocols, right? If you go to a band field, which I'm not saying you have to, but if you go to a band field, part of their big business program, and it's also their medicine program, is a wellness program, is getting people on annual wellness visits. And you can say what you want about the business aspect of that, but the medicine aspect of it is amazing. And so if you as a veterinarian, or if you as a pet owner go to a vet that isn't pushing this stuff, ask questions. And it's happening in the vet industry. So people need to be aware of that. And it's on kind of everybody to make sure it progresses, even those pet owners. So don't be afraid. Ask questions. There's no such thing as a stupid question. The vet will hopefully inform you on the best answers or the best pathways going forward. So please don't feel afraid to ask questions.
Yeah, no, I think it's a great point, right? Doctor, there's a lot of stigmas around Dr. Google, but one of the things that I've seen, and one of the goals that we have here on Pet Working is to make people more responsible pet owners and to allow them to better advocate for their pet's health. I think if we've seen the trend in human medicine over the last several years, where the health conditions of humans have improved as people have become better advocates for their own health. They become better informed to ask questions, to monitor themselves. It's difficult to do that with a pet because they can't talk to you. And if you can't, you can't talk to your pet, there needs to be proxies so that you can have that baseline. And Jess, I think you alluded to it earlier, right? If, I think 2 or 3 years ago, we started doing a senior panel for Peony every year when she went to the vet, just so we have that baseline. We know where she's at. We know what her blood levels are. We know, what her kidney function is. And we'll be doing an upcoming episode on this, but over the summer, I had a startup company reach out to me. It's called Invoxia. They're a division of Withings, which is a big health tracker over in Europe. They don't have quite as big a market share here in the US, but Invoxia is a division of Withings, or I think they share the same CEO, but they've come out with they do a lot of GPS trackers, but they've come out with a smart pet tracker that also incorporates a heart monitor and a respiratory monitor, and does what they call a heart signature, which I have come to understand is their version of a dog EKG. And I know we talked about pet insurance as being, obviously we want to push the adoption of pet insurance, because if people have pet insurance, a lot of these preventative diagnostics are covered under health insurance. I will add the caveat: check your health. If you have pet health insurance, check your plan, make sure it's covered. Don't take my word for it, but a lot of plans do cover it. But even if you don't, having that baseline and being, one of the things that I looked at with that is like being able to see, this is my, pet's average resting heart rate. This is my pet's average resting respiratory rate. This is what their heart signature has looked like. And if you see deviances from those, that can be a great cue to get to the vet.
Well, I think go ahead. Sorry.
Yeah, no, that's okay. I was just going to say, I think that's really important, right? And I think that the data, I think, is, making data-driven kind of decisions, using it to inform. It not only helps, the vet and making their next step, for treatment, for, whatever the next plausible step is, but also too for the pet owner to like understand, okay, maybe, they haven't elevated this, I need to watch for this or that. And I think that, back to Ben's point was, just like, is there a disconnect? And I don't know if I know the answer, but is there a disconnect, around like pet parent education, and how important it is to bring your pet to the vet? I think everybody can wrap their head around that, but I think the kind of rationale or the reason or the importance behind it is something that, may drive that compliance towards like annual visits and things like that a lot more. But I think the data is really important. And I think that understanding why that's important can help that, compliance grow.
Definitely. I would also just add at the end there, these devices, there's a lot out there, and there's new innovations and devices coming out all the time. It's just going to expand the industry and hopefully reduce costs down the line, right? What you were talking about, Peter, and Jess too, if there's a heart monitor, if there's something that can kind of equilibrate or be like an EKG, and I've seen also very small ultrasound units that you can carry around, it makes it so that certain cardiac diagnostics aren't as expensive. I don't necessarily need to go into a specialist. The specialist will still still watch the case, but I have things at home that I can use, or I have previous data from thousands of pets that are wearing this device, that kind of thing. That's the other thing that, be careful for pet owners, please, research stuff before you buy it. But these innovations are going to help the industry and pets in general down the line.
Yeah. And one of the things I liken it to, and I'm kind of surprised we haven't seen more of an advance in this on the human medicine side, but it's charging right now. But I've worn a smartwatch for years. Mm-hmm. And every time I go into my doctor and, I go regularly. So they have my baseline, they have my blood pressure, they have my heart rate, things like that. But I've got a treasure trove of data that could show, and there's very little interest in looking at it. And I'm curious, Ben, do you see, as things like heart monitors and, such become more common for pets, do you see vets, being willing to look at that data and, and trust, like, okay, this is more, when we think about a pet's experience in going to the vet, I would imagine that it's very hard to get an accurate heart rate or respiratory rate on a pet that is in the clinic, because they're nervous, right? They're panting, they're scared. You're not getting a true baseline. So I really wonder, in addition to, the diagnostics that need to be administered in the clinic and have samples taken in the clinic, what do you see as the future in terms of incorporating D2C diagnostics and marrying that with the medicine that you're practicing in the clinic?
Yeah, I wish I knew a definitive answer, because you're right. There's a unique aspect to veterinary medicine, right? The pets, they don't know what's going on. They really don't understand that. They also can't tell us what's going on. And like you mentioned before, they're also really good at hiding stuff. So things like heart rate, things like blood pressure, glucose monitoring. If you know about cats, you know that cats are particularly tough to get accurate glucose measurements when they're stressed. And you can imagine how stressed they can get at the clinic. So at-home monitoring, like you said, kind of like melding a little bit of in-clinic diagnostics or even reference lab diagnostics with at-home capabilities. I think that's where it's going to go. And in people too, I don't know as much about the human medicine market, but I think you see a little bit that in people. It's just maybe a little bit more necessary in pets because of that, lack. They don't understand what's going on. They don't have that awareness, and they also react to things a little bit more strongly than some adult people might. So doing things at home, having that lower stress environment, but still getting the same data, still getting the same values, maybe even being able to do urine tests and things like that. I think it's the future. And so I think that kind of just being able to gather more information is where medicine is going. And hopefully veterinarians in general don't push back on that too much. If I was still practicing, I'd be open to it. We have to be careful because not everything new is good. But I think that is where it's going, is that we're going to see a lot more capabilities in the house, like you said, wearables or things that we can recommend at home or outside the clinic, we could say.
Jess, from your perspective, as a diagnostic support consultant, what were the tests that, I know you mentioned they weren't really at a preventative level, but in your opinion, where do you see the least potential for user error, and where do you see, potential migration for preventative tests to a D2C environment?
That's a good question. I think urine is very hard. That was something that, collecting that at home for, a pet parent to collect their own pets. Urine at home is always been very hard. That the idea of free catch. Peter, I think touched on this back, a few months ago in the introduction to Jess kind of podcast episode that we had. But that's really hard. And so it's not guaranteed. There's risk of contamination. There's not enough sample to run the test, quantity wise, whatever the case may be. But I think least impact, that's a really good question. I think fecal could be a good one, but I think you may also run into some of the same similar issues. I think I'm primarily talking about dogs. Cats I know are a bit more finicky, and I think a lot of the wellness tests that I used to deal with in my role at IDEXX was really for canines. Not that we never saw anything for felines, but they were a little bit more, I think, specific tests like, oh, it's a heartworm, or oh, it's a glucose. That's a good one as well for diabetes. So least impact. I think that's a hard question, and I don't know if I have an answer for it per se, but I do see the benefit in at-home diagnostics for pets, especially to alleviate their anxiety. I think you get better results when they're more calm. They know where they are. Okay, mom or dad is right here. Parent is right here. But I think the wearables have a really strong potential, and I think D2C does as well.
Ben, I'd be curious from your perspective. Heska is known for kind of being a leader in point of care diagnostics. So, I would say that that's one of the things that really separates Heska from the IDEXX, Zoetis, Abaxis, Antex of the world. Heska has, point of care capabilities that, going back years to my experience in human diagnostics, that really, I oftentimes think of Heska as sort of a animal health corollary to Cepheid, and doing a really good job of giving clinics the ability to get rapid results to their patients, while they're in the clinic. Do you see, going down? I'd be curious, in your opinion, what are the tests that you would feel most comfortable pushing to a D2C spectrum? And is that anything that Heska is looking to, extend its expertise in point of care to a D2C setting?
Sure, potentially. And I will say that we are now the same as Antec. So Antec is a reference lab for those that don't know, and we are under the same umbrella. But you're right. Heska for, more than a decade now, around a decade now, has been really focused on in-house point of care diagnostics. And we already do market something to the pet owner, and it's our allergen testing and therapy. Although that's not really point of care because the blood sample is taken at the veterinarian, but they send it to our lab. So in terms of, the question about point of care results is a good one because it's the difference between getting results right then and there and then having to wait a little while. It depends, right? A few hours or maybe a few days for results. And in human medicine, I know, at least when I've been to the doctor, we wait, right? We don't get results right then and there. But in vet med, there is that opportunity. And a lot of pet owners want that And so the question is, well, what test makes the most sense? Allergy, absolutely, because pet owners see that at home a lot, right? Pet's itching, I'm going to go to the vet and they're going to do a test. If we could do allergy in-house, that'd be amazing. And that might be in the pipeline eventually with Heska. We'll let you all know if that happens. But otherwise,
All right.
you're right. Yeah, hopefully soon. Direct to consumer wise, heartworm testing, infectious disease testing, the things that the pet owner should be doing really annually, in addition to vaccines. And yeah, they should be getting a minimum database of blood work. So, organ stuff, organ function tests and blood counts, but infectious disease, especially in pets, right? Heartworm, you mentioned it, heartworm testing, the fecal testing, things like that right to the pet owner, because it's so important. And, if pet owners don't realize this, some of these diseases are possibly transmissible to themselves, to the people. So it's really, really important. Prevention, again, what we're talking about, but especially infectious disease and parasite prevention. And I'll tell you all, it's not a secret, and I won't speak for all MDs, but a couple MD friends of mine that I've known, when I've talked to them about my parasitology courses in veterinary medicine and when I was in school, they're shocked because they don't get that same level. And it makes sense. In the United States, we don't have a lot of human parasites roaming around. But if you got pets, that's not always the case. Hookworms, Giardia. If you've ever heard of Montezuma's Revenge, I apologize if that's not the appropriate term, but when you get really bad diarrhea, that can come from pets. So it's really important. And those are the tests that really hit home with pet owners.
Yep. Yeah, no, absolutely. I think we ruled out that it came from her, but I got Giardia probably 5 years ago, and it was not fun. And thankfully, Peony was negative for it, but and I must have picked it up in a swimming hole or something somewhere. But yeah, it is one of those things that I guess I want to ask though, Ben. When we talk about like blood collection, and are those things that you feel comfortable? When we talk about, obviously those are things that pet parents should be doing on a regular basis, but that to me seems more of something that I want my pet in the clinic, or I want a vet tech or a veterinarian collecting the sample. I can't imagine collecting blood from my dog, and I really feel like that probably would damage the trust that we have between each other if she felt like I was harming her, even though it's for her own benefit, like you said, and they don't really understand.
They don't understand. And when I say direct to consumer, it's really just to get pet owners to ask their vets about it. So vets are very busy. There should be records that they know, okay, this pet hasn't had a heartworm test this year, so we need to do a heartworm test. But sometimes it gets missed. Or maybe the pet owner just really wants to have another heartworm test done. They lapsed in their heartworm treatment and the pet was outside near mosquitoes. So, oh God, we should have another one done. And that's why we want to increase utilization, because again, if we can eradicate somehow these diseases, that would be amazing. And a step to eradication is diagnostic testing. We got to make sure we're testing and secluding and treating all of these pets that come down with these infectious diseases. So that's what I mean by direct to, when we market, if we market to pet owners, it's, hey, we have this test, ask your vet about it, because we're not going to ask you to do blood testing at home. Maybe a poop sample. So if they have Giardia or GI upset, maybe that pet owner can bring the poop sample in. But otherwise, it's really just to get them to be aware of these tests and to make sure that they're asking about it if they haven't been done lately.
Yeah, no, definitely with the fecal. And I think you alluded to this, Jess. It's, probably the most potential for pet owners, pet parents to take a more active step in these diagnostics. I know every year when we do a fecal for Peony, I always just bring it in because, there's no guarantee she's going to go while we're at the vet. And, I think we are even starting to see, another upcoming episode we have here on Pet Working is going to be with Animal Biome, and I did a test on Peony. They sent us a test to sample, and we're going to be talking about it with them in the coming weeks. But analyzing her microbiome based on a fecal sample, and yeah, it's a little interesting to be kind of going in and scooping your dog's poop out on the counter, but you do get a wealth of data from it, and it is that baseline. It gets back to, being able to have these markers to track and refer back to as your pet ages, as their health conditions change. I think, so it was a great point that you made, Jess. So much of it is just around that collection of data and having that baseline. Because, and getting back to the point we made at the outset of the episode, if you're not seeing a pet regularly, it's really, the chances that these conditions are going to arise increases exponentially. And if you are being seen regularly, the chances that you can head things off, is that also rises exponentially.
Yeah, and I think the data too that you get from all of this, right, just benefits everyone, benefits the entire market too, right? Because the more we have, and I think we've seen this with, with Mars, right, with their the data that they're collecting and how they're bringing that to bring technology to market, different technologies and things like that. And I think, that's just an example of it. There's many other companies out there that are doing it, but that more and more and more data, that we can better understand disease biology, and we can help to, push these development timelines too, right? You think that takes, years to get a product to market. And the more data that we have, that just benefits everyone to get these, R&D types of timelines like reduced, and we can bring things to market a lot faster. So there's, two sides of the coin and a lot of benefits that I know I keep talking about data, but it's just so important, especially, where pets can't talk to us and, tell us things that are going on, even like, symptom wise, subjective, things that, it's all objective with patients. We're just running on data, with pets rather. Yeah.
Ben, kind of tying this back to the consumer, when you look at your experience practicing, with or without, Heska Diagnostics or within the Heska portfolio, what are the most common preventative tests that you sell? And from a pet owner's perspective, what should they be preparing if I'm a person who has not had a dog before or has not had a cat before, what should I be budgeting, to ensure that I can pay for the requisite preventative diagnostic tests that you would recommend as a vet I be getting every year?
Yeah, it's an in-depth question too, because if we're talking about the entire life stage, and I won't go into too much depth, we only have a certain amount of time, but if you're talking about puppies, that first year, if you have a puppy, you're going to be going to the vet more frequently. So be prepared for that. Unless they've had all their shots and they've already been spayed or neutered, you're talking about 3 or 4 vet appointments in that first year, just to get them up to date and to make sure everything's looking good. So puppies are a little bit different. And like we've been talking about, once you get out of that puppy stage, I'd like to be seeing them once a year. And the most common preventative diagnostics that we usually do are some of the things we mentioned. So heartworm testing for dogs, sometimes for cats, but usually for dogs. There is feline viral testing that maybe you do once a year, but most likely just once. There's the urine and fecal analysis, especially the fecal. Well, actually, both should be once a year once they've reached that adult stage. And then there's some blood work too, outside of heartworm testing in dogs. A chemistry evaluation, which that's that organ function testing that we get too, right? When we go to the physician, they look at our kidneys, they look at our liver, and it's with a blood sample. So chemistry is an important one, and there's different levels of chemistry, how many values you're looking at. There's big panels and short ones that don't have as many values. And then there's CBC, or our hematology. That's our blood counts, right? Just like you and I get. So we're looking at red blood cells, white blood cells, platelets. Those are the common things. And so that was, we'll recap. There's heartworm testing, so infectious disease with dogs, and then some feline viral testing with cats, urine and fecal testing, especially that fecal testing if they're predisposed or in an area with a high parasite load, once a year, urine, fecal testing. And then there's some blood testing, chemistry, organ tests, and then your complete blood counts. And then plus or minus, depending on age, I think like both of you have talked about, you might add a little bit of imaging in there. So maybe an x-ray once a year, maybe, especially if they have a history of having any issues that you can pick up on x-ray, cancer, bone issues, anything like that. And so that's what we would probably term the minimum database that we would want annually or semi-annually with dogs and cats. Blood work, urine, fecal, maybe some x-rays. And we'll omit the x-rays because those can be kind of expensive. You're probably looking for 3 views, which is the traditional amount of x-rays that you would take in animals. Oh gosh, I hesitate to say, but probably the lowest you're going to pay for that is about $150. and it can go up to probably $300 or more for 3 x-rays. And you don't always do that once a year. So we'll forget that for now. But the other things are going to be more routine. So heartworm testing, not too expensive. Again, this is very much going to depend on where you go, your veterinarian, even your region, right? Cost of living will impact these numbers. But heartworm testing shouldn't be too expensive, $20, $30, maybe $50 at most for a heartworm test, I would think. Your urine and fecal, similar. Urine's going to be a little bit more, but fecal shouldn't be much more than that, 20, $30, something like that. Blood work is going to depend. So the CBC is somewhat standard in that you're looking at red blood cells, white blood cells, platelets. Sometimes you'll get some extra stuff in there. It depends on if you're running it in-house or at the ref lab. But the CBC will run you minimum probably $50 or $60 is my guess these days, but upwards of $100 for a CBC. Similar for a chemistry. And again, it depends on what values you're looking at. If it's a small little panel, which puppies and young dogs, they don't necessarily need that really extensive panel. Like maybe you or I, at our ages, we're getting like lipid panels when we go to the doctor, right? Stuff like that. When they're young dogs, they don't need that extensive panel. Okay, that's fine. So it's going to be a little bit cheaper to do that chemistry. So maybe another $60 or $100. So if you're thinking about all in one visit, several $100s, right? And hopefully you just make one visit a year, especially when they're young, excluding puppies when you're going more frequently and you're not paying that much for each puppy visit. So it's still a considerable expense, right? For a lot of people. And that goes back, we can, like you said, we can spend a whole episode on pet insurance, but pet insurance is a good idea. I don't work for a pet insurance company. I advocated for it when I was a clinician, and I advocate for it now because if you find a plan that works for you and your pet, it makes a lot of difference. And that $300 to $400 vet visit once a year becomes $20, $50, depending on what plan you have.
Yeah, we just did an episode with Pet Insurance Review. They are a new company that is going around trying to provide their non-biased. They just provide independent reviews of the different pet insurance plans that are out there in the market, and they distribute them to veterinary offices so that vets can give their patients, information about pet insurance. Obviously, most veterinarians are not licensed insurance agents or brokers, so they can't get into discussing the particulars of a given plan. But if you, at least if you provide literature and awareness and advocate that it's a good idea, I think that goes a long way. And certainly I would be happy, be great to do an episode on pet insurance at some point. And I know we're coming up on time here, but I kind of wanted to close with maybe a little teaser for a future episode based on something you said, Ben, was, talking about using x-rays as, a proxy to detect cancer or other diseases. And I know we've talked a lot about preventative in terms of infectious disease and dental and things like that, but also regular vet visits can be pretty instrumental in catching, some of the more serious illnesses like cancer early on. And if you feel comfortable bringing your pet to the vet, when you feel a lump on your pet, I've had that experience with Peony. We caught melanoma before it, and she's 4 years survived on that now. But, can you talk a little bit about that? And I know we talked maybe, later this year, we're going to have an episode on some of the cancer diagnostics that Heska has.
Yeah, absolutely. Yeah, I mean, you bring up a good point. And again, there's parallels with human medicine, right? Oncology is a huge division of human medicine for understandable reasons. And one thing that we can do better in pets is catch cancer earlier. And now there's tools. There's a lot of tools coming out. In addition to imaging, imaging is one of the best ways to catch cancer. When you're talking about people or animals, whatever species, you're talking about x-rays, CT scans, MRIs. I'm not sure if the veterinary world has gone into PET scans yet, but they're doing PET scans in people. So there's a lot of advanced imaging. But there's also new tools coming out, blood diagnostics. There's a urine test out there for pets that are going to help catch cancer earlier. And, I have to go back in my thoughts for a second. 6 million, I think, 6 million cancer diagnoses each year in dogs. And that's the ones we catch. And a lot of those are too late, right? Like we're talking about, we catch things too late in veterinary medicine, and it's nobody's fault. So hopefully the pet owners out there, it's not your fault if it gets caught late. We need better tools, and they're coming out. It's going to be a little bit slow, like you said. Hopefully we can chat about them specifically later in the year, but there's a lot of stuff it's hopeful in the sense of we're going to have a lot more tools, but we're talking about cancer, so we have to be better about catching it, and hopefully that'll happen soon.
Yeah, no, I know at Western Vet, Jess and I were both psyched when we saw the new Q partnership with Heska, and ability to turn around a cancer diagnosis, maybe not as specific as it could be, but giving you a good sense of whether there's a risk of cancer there within 10 minutes while you're at the clinic. We've seen PetDX, which comes from the Illumina technology. Jess, I know you've done, in addition to your work at IDEXX, you've done a ton of work on the human diagnostic side of things, looking at cancer diagnostics in the time you've been at Maya. I don't know if you have any thoughts on cancer diagnostics that you want to share and tee up for people in a future episode, but
yeah, so keeping it to the pet world, I definitely have a strong background in the human diagnostics across point of care through the different complexity of instruments that are in like hospital labs and core labs, and also to like tissue diagnostics or pathology, right? So kind of bringing me back to my days at IDEXX, and there weren't a lot of these tests, right? Like these new Qs or the PetDX or anything like that. Diagnostic wise, it was kind of the more conventional methods, right? Like biopsy, or maybe it was a very specific test, and it was sent out to like Kansas State University, who did a lot of like send out tests, things that IDEXX didn't do themselves, but had partnerships or what have you. So you didn't see a lot of that now. So like the progress that has been made, and now there are all these tools, and Ben had kind of alluded to maybe more to come as well. I think it's great, but it's interesting for me to just kind of watch, because before it was, I have to do a biopsy on this patient in order to get them like any kind of diagnostic information, and that was a lot, because that's costly. You're paying for a biopsy. A pathologist has to look at that. And then maybe the added expense too of having to send that out. Because, there was obviously, it was IDEXX's test, and there's markup, and there's, you have to send it out, and it's, it's not just going to IDEXX's reference labs. So there's a lot of like cost considerations that go into that too. And we've talked about how cost is a major, barrier to getting pets, annual visits or just, and the care that they need, as for the pet owners. So interesting to kind of bring that all full circle, but it didn't exist before. So it's really great to see. And I'm really excited to learn more about all the options that are coming out, because there's perceived benefits to all the different types of tests and the approaches that they take.
Yeah, I think it's one of those things that, circling back to, to the original focus of this episode, it is preventative, right? Ultimately, if we can catch cancer early, and the more technologies we have available to do it, the more that will fall into the spectrum of preventative diagnostics. But it all starts with taking your pet to the vet more frequently, right? And you don't know, like we said, dogs and cats, they're master manipulators of being able to mask symptoms. And if you don't take them, it's going to be an issue. I think it does get back to this idea of, it's incumbent upon us as pet owners to, make veterinarians' jobs easier, right? If we really do think of pets as our family, and are going to care for them as members of our family, and our kids, our fur babies, so to speak, we've got to be bringing them to the vet, right? You wouldn't not take your kids to the pediatrician. So if we're going to call them our kids, like, to me, it's pretty fundamental. You've got to start treating them that way. And I think at the outset, that starts with getting pet insurance. So it's not a financial decision about whether you're taking them to the vet or not. And then it's actually making sure that you're bringing them to the vet regularly. If you have a concern, go to the vet. Or at least invest in some sort of telemedicine, so you can get advice about whether that pet needs to be seen. And then, beyond that, it's, making sure that, you're not contributing to this issue of compassion fatigue, by allowing your pet to get to a point where they haven't been seen. If you're investing in pet insurance and bringing your pet to the vet regularly and not making it a financial decision, I think that really starts to change the curve on which veterinary medicine is practiced in this country. So, and you don't know what you're going to catch. I have been lucky more than a few times with P&E because I worked in the industry and I knew the benefits of pet insurance, and I've never been afraid to take her to the vet. And so far, when we adopted her, she was deemed heartworm negative. We took her to the vet 3 months after getting her because she seemed to pull a hamstring. They did a snap test. She was heartworm positive. The microfilariae hadn't gotten to the point where she could be positively diagnosed in the shelter. If we hadn't had that, and that goes another 3 months, she's probably not with us. The melanoma, the same thing. And so it's something I'm really passionate about because I know people care just as much about their dogs as I do about Peony. And we all want our dogs to be members of the family, but if you're not checking up on their health regularly, you're going to get hit with a surprise that could mean that you're losing a family member, and nobody wants to see that.
Right. And one thing I'll add, you're 100%. One thing I'll add too is there might be some pet owners out there who aren't worried necessarily about the cost, but they worry about their pet's mental health going to the vet. The pet gets super stressed, they get aggressive, things like that. And the only thing that I would say to those people is there are options out there for you and your pets. So don't just exclude vet visits or make them infrequent because it's stressful for the pet. There's fear-free practices, which is an organization that does certifications. There's at-home visits. So there's, home vets that'll come to your house. So please, even if they get stressed at the vet, there are other options for you.
Yeah, that's a great point, Ben. And televet too. I mean, it's they're definitely, I can fully empathize with people who, taking their pet to the vet is a stressful experience. So yeah, that definitely a lot to unpack. And I know we're at time here, but thank you guys both for taking the time. Awesome to have the veterinary perspective, the consultant perspective, and hopefully this makes a bit of difference in terms of for everyone understanding what diagnostics options are out there for you, some of the the business challenges behind advancing the sale of preventative diagnostics, and really at the end of the day, it's not a hard sell, right? It all gets back to making things better for pet owners and their pets. So psyched that everyone had a chance to join us on Pet Working today. Thanks for hanging out. Thanks for listening. Jess, thank you for joining. Ben, thank you for joining. And we will look forward to future episodes. Jess, I don't know if you want to tease a couple of the upcoming topics that we might get into. I know we talked a little bit about the cancer piece coming later this year, but
yes. So some of the other ones, still kind of in the diagnostics realm. I think we have some ER diagnostics. There's also some the cancer diagnostics, obviously, as well. There's also the telepathology, the telecytology types of innovations, and then also too, I think parasite monitoring are some of the other ones that are coming up, which are big topics in and of themselves, but we'll unpack them on upcoming episodes. Looking forward to it.
Great. And Ben, we're looking forward to having you back. I know some members of your team, some of your fellow product managers might be joining us on these upcoming episodes. Anything you want to share there?
We're excited about it. Thank you. First of all, thank you for having me. And yeah, we're excited about it because again, it's a lot of it is about just increasing awareness, right? We're in the digital age, we're in the information age. So increasing awareness with pet owners about what we do as vets, and now as this diagnostic kind of specialist, it's really exciting for us. So we're really happy to be a part of it.
Awesome. Well, thank you again both for joining. This has been a fantastic conversation, and I'm looking forward to more. For Jess and Ben, this is Peter Kenseth with Pet Working, and we thank everybody for hanging out and looking forward to future episodes coming up. Have a great day, everyone. Networking is presented by Maya Strategy Group, a leading market research and strategy consulting firm, helping clients in the pet care and animal health industries navigate strategic challenges for almost 2 decades.